Assalamualaikum warahmatullahi wabarakatuh and hi, my name is Nur Adrina Shahira Binti Solihin and today my teammates and I are gonna presenting on our answer for a given situation from Pbl 2 of biology subject. So here is the problem statement where Emma and David is expecting their firstborn, but a doctor revealed that Emma is at risk of complications due to rhesus factor incompatibility since she is a Rh negative while the baby is Rh positive. They are in a state of confusion and concern whether to proceed or terminate the pregnancy. In order to help them in making decision, I'm gonna simply put myself as David. As David, I will definitely proceed the pregnancy of our firstborn. And here is why.
Rhesus is and what rhesus factor is. So, in simple words, rhesus factor is actually the protein found on the surface of red blood cells, which is known as the rhesus factor, or also often referred to as rhesus or Rh. The protein is actually part of component of the larger blood type system where its presence and its absence determines whether you are a Rh positive person or an Rh negative person. For example, we have the ABO blood groups, but in this each ABO there are negative and positive. For example, A positive, AB positive, A O positive, or A negative, AB negative, or O negative. The positive and negative actually shows if whether the Rh antigen or the antigen whether the Rh the rhesus is actually present or better known as the antigen D. If the antigen D is actually present in the surface of that red blood cell, therefore you are an Rh positive person. So this is actually important to be known because certain issues might arise regarding to Rh incompatibility between a pregnant woman and an unborn child. In the event that we have Rh negative mother and an Rh positive baby, this will actually put harm to the baby. But at the first pregnancy, it will usually be okay because the antibody produced will not be sufficient to harm the baby. But however, at the second pregnancy, the antibody will cause the blood of the baby to agglutinate, eventually leading to the death of the baby. So this Rh factor is also crucial in blood transfusion to prevent that or agglutination of RBCs. That's all for me. I'll let my next member to tell more about this.
I will explain the rhesus factor incompatibility and its causes. So what is rhesus factor incompatibility? Rhesus factor incompatibility, or also known as Rh incompatibility, occurs when a mother who is Rh negative is pregnant with a fetus who is Rh positive. The causes of Rh incompatibility is primarily because of the mixing of blood between the mother and the fetus, typically during childbirth or other pregnancy-related events. So, if Rh negative mother or woman is carrying a Rh positive baby, her immune system perceives the Rh positive blood cells as foreign. This will lead to immune response. So during this time, the mother's immune system produces antibodies against the Rh positive blood cells.
Hi, so today I'll be explaining what are the implications, when will it affect the child, and which pregnancy will it affect for the couple's child. And the effects of RH incompatibility on the child can actually vary. In mild cases, there might not be any noticeable effects. However, in more severe cases, it can lead to hemolytic disease of the newborn, which can cause jaundice, anemia, and extreme cases, serious complications such as brain damage or even death. And some of the mild noticeable effect that I spoken about is brain damage, fluid buildup, and problems with mental function, movement, hearing, speech, and seizures. And the RH incompatibility can affect the child during pregnancy and during pregnancy only. If the mother is RH negative and the baby is RH positive, which in this situation they are. The effects typically occur when the mother's immune system recognizes the Rh positive blood cells of the baby as foreign and produces antibodies against them. And which pregnancy will it affect actually? Incompatibility is more likely to affect subsequent pregnancies rather than the first one. This is because sensitization to Rh positive blood cells usually occurs during the first pregnancy with Rh positive babies, and subsequent pregnancies with Rh babies are at higher risk of complications. So most likely the first baby that they which will be having is actually safe and sound.
Assalamualaikum, I'm If Alia. I'm going to present about the potential risks and symptoms of rhesus factor incompatibility. So, first and foremost, who is at risk for RH disease? Women who are RH negative and are pregnant with a baby whose father is RH positive are at risk for this condition. The risk is much higher if they have been pregnant before. This is because in this time the mother's body will produce antibodies. This will put the second fetus at risk for complications. Once the body realizes the fetus is Rh positive, antibodies can pass into the fetus blood and attack its red blood cells. This can be life-threatening for the fetus. Here are charts of fetus risk for Rh incompatibility. The first one is when both parents are Rh positive, the risk level is none. The second chart is when both parents are Rh negative, the risk level is also none. The third one is when the mother is Rh positive but the father is Rh negative, the risk level is also none. Lastly is when the mother is Rh negative but the father is Rh positive, the risk level is high. Next, let's talk about the potential risk of rhesus factor incompatibility. The first one is anemia. Rh incompatibility can lead to the destruction of the baby's red blood cells by the mother's antibodies, resulting in anemia. Anemia can occur when impaired oxygen delivery to tissues and organs. Second one is jaundice. The breakdown of the red blood cells causes the accumulation of bilirubin in the baby's bloodstream, leading to jaundice. The third one is heart failure. Severe anemia and hemolysis in Rh disease can put a strain on the baby's heart, leading to heart failure. Heart failure occurs when the heart is unable to pump enough blood to meet the body's needs. The fourth one is kernicterus. Accumulation of bilirubin in the baby's brain can lead to kernicterus. This can cause brain damage and neurological impairments, including developmental delays. Lastly, what are the symptoms of Rh disease? So, symptoms of Rh disease can occur during the pregnancy and after birth. During the pregnancy, the symptoms are a yellow coloring of amniotic fluid. This color may be because of bilirubin, which is a substance that is released when blood cells break down. There may also be extra fluid in the baby's stomach, lung, or scalp. There are signs of hydrops fetalis. This causes severe swelling. The symptoms for after birth are jaundice, anemia, and lack of energy. That's all from me. I will pass to the next presenter.
Next, we move on to the next question, which is what is the preventive measures available? So the answer is receive ROGAM injections. ROGAM is a medication containing RH antibodies to help prevent your body from making its own antibodies against your baby's RH positive red blood cells. And typically, the person who receives ROGAM injections will receive it at specific times, which is during her pregnancy, such as around 28 weeks gestation, within 72 hours after delivery if your baby is RH positive, and lastly after any event that could cause fetal maternal hemorrhage such as miscarriage. Next question is how to diagnose. For the mother, firstly, the doctor will use the RH factor test, which is this is a simple blood test usually done at the first prenatal appointment. Second is antibody screen, which is the blood test also checks for the presence of RH antibodies in the mother's blood. And lastly, for the mother is indirect Coombs test, which is this test is specifically checks for RH antibodies in the mother's blood. While for the baby, fetal blood sampling will be used. In some cases, a blood sample may be taken from the baby's umbilical cord to determine their RH factor. And second is amniocentesis. This is uric acid, which the procedure may be used to analyze the amniotic fluid surrounding the baby for bilirubin, a byproduct of red blood cell breakdown, which can be elevated in RH incompatibility. So last question is what medications is used? So the medications is ROGAM, which is ROGAM works by binding the fetal RH positive cells before they can trigger the mother's immune response. This can be considered as the mask of the cells, which is for preventing the formation of harmful antibodies.